Every morning after 60, many women stand in front of the mirror wondering why their wrinkles refuse to soften, even though they have tried creams, serums, and collagen supplements for years, yet their skin still looks more tired with each passing night. What most women don't realize is that turmeric, a spice they have known for decades, may help slow the silent breakdown of collagen, not by acting on the surface, but by supporting the skin's repair process deep inside the body while they sleep. For years, the beauty industry has encouraged women to chase smoother skin from the outside, yet very few conversations explain what actually determines whether collagen is repaired or quietly broken down after 60. As we age, inflammation increases, repair signals weaken, and the skin gradually loses its ability to recover overnight, no matter how many products are used during the day. I'm Dr. Eliza Hart, a board-certified obstetrician and gynecologist with over 15 years of experience in women's health and hormonal wellness. And today, I'll explain how turmeric supports collagen repair after 60. In this video, I'll show you simple, science-based ways to use turmeric that align with how the body naturally protects and repairs skin as we age. Before we begin, please subscribe to the channel and leave a comment telling me which country you're watching from so I can see how this message is reaching women around the world. And be sure to watch until the very end, because I have a small surprise related to this topic that may change how you think about wrinkle repair, starting with why wrinkles deepen after 60 in the first place. 1. Why wrinkles deepen after 60? As women move beyond the age of 60, wrinkles rarely appear suddenly. Instead, they seem to settle more deeply into the skin, becoming harder to smooth and more resistant to the routines that once worked. In my clinical experience, this shift is often misunderstood as simple aging, when in reality it reflects a deeper biological imbalance between collagen breakdown and collagen repair, an imbalance that quietly accelerates after menopause. One of the most significant changes is the decline in estrogen, a hormone that plays a direct role in maintaining skin thickness, elasticity, and collagen density. Research published in the Journal of Investigative Dermatology has shown that women can lose up to 30% of their skin collagen within the first 5 years after menopause, followed by an ongoing annual decline. This loss is not merely cosmetic. Estrogen receptors in the skin influence blood flow, fibroblast activity, and the skin's ability to respond to repair signals, all of which weaken as hormone levels fall. At the same time, low-grade chronic inflammation becomes more common with age, a process often referred to as inflammaging. Studies in dermatoendocrinology have demonstrated that persistent inflammatory markers activate matrix metalloproteinases, enzymes that degrade collagen fibers and compromise the skin's structural support. When these enzymes remain active for long periods, fine lines gradually deepen into more permanent wrinkles, even when the skin appears well hydrated on the surface. Nighttime is designed to counterbalance this damage because collagen synthesis and cellular repair are most active during deep sleep. However, sleep quality frequently declines after 60, and fragmented sleep has measurable effects on skin biology. A controlled study published in Clinical and Experimental Dermatology found that poor sleep quality was associated with increased signs of intrinsic skin aging, including reduced elasticity and slower barrier recovery. Elevated nighttime cortisol, which is common in lighter disrupted sleep, further suppresses fibroblast activity and collagen production. Reduced circulation also plays a role. Aging blood vessels deliver oxygen and nutrients less efficiently to the skin, limiting the raw materials required for repair. Over time, the combined effects of hormonal decline, inflammation, impaired sleep, and reduced blood flow create an environment where collagen is broken down faster than it can be restored. Wrinkles in this context are not a failure of skincare, but a signal that the skin's internal repair systems are under strain. Recognizing this process is essential because it shifts the focus away from surface treatments alone and towards strategies that support collagen protection and internal balance, which sets the stage for understanding how targeted interventions can make a meaningful difference after 60. 2. Why turmeric works for collagen after 60. Once we understand that wrinkles deepen because collagen is being broken down faster than it can be repaired, the next question becomes far more practical and far more important: what can actually slow this process in a way that respects how the body changes after 60. This is where turmeric deserves attention, not as a beauty trend or folk remedy, but as a compound that has been studied for its effects on inflammation, collagen integrity, and cellular aging. The key active component in turmeric is curcumin, a polyphenol with powerful anti-inflammatory and antioxidant properties. As women age, low-grade chronic inflammation quietly accelerates collagen degradation by activating enzymes known as matrix metalloproteinases, or MMPs, which break down collagen fibers. Research published in the Journal of Clinical Biochemistry and Nutrition has shown that curcumin can downregulate the activity of these collagen-degrading enzymes, helping preserve the skin's structural framework rather than forcing it to rebuild under constant attack. Equally important is curcumin's role in reducing oxidative stress, which increases naturally with age and further weakens collagen bonds. A review in Oxidative Medicine and Cellular Longevity highlighted curcumin's ability to neutralize reactive oxygen species that damage skin proteins and accelerate visible aging. When oxidative stress is reduced, fibroblasts, the cells responsible for maintaining collagen, are better able to function in a stable, supportive environment. What makes turmeric especially relevant after 60 is that it works with the body's limitations rather than against them. At this stage of life, collagen production is slower and more energy-intensive, so protecting existing collagen becomes just as important as stimulating new synthesis. Curcumin supports this protective approach by calming inflammatory signaling pathways, such as NF-κB, which are often overactive in aging tissues and linked to accelerated skin thinning. Clinical observations also suggest that reducing systemic inflammation can improve how the skin responds to nighttime repair signals. When inflammatory load is lower, cortisol levels are less disruptive. Circulation improves modestly, and the skin is more receptive to the natural repair processes that occur during rest. This does not mean turmeric rebuilds collagen overnight, but it does help remove the biological obstacles that prevent repair from happening at all. Understanding turmeric in this context shifts expectations in a healthy direction. Rather than promising rapid transformation, it offers something far more realistic and sustainable: a way to slow collagen loss, stabilize skin structure, and support the conditions under which repair can gradually resume. With that foundation in place, the question is no longer whether turmeric works, but how it should be used to align with the body's natural rhythms after 60. 3. Method 1. Turmeric with healthy fat. Once turmeric is introduced into the conversation about collagen after 60, one critical detail often gets overlooked, and this is where many well-intentioned women unknowingly undermine its potential. Curcumin, the active compound in turmeric, is not water-soluble, which means that simply mixing turmeric powder into hot water or tea delivers only a fraction of its biological benefit. From a medical perspective, this is not a minor technicality, but a fundamental issue of absorption that determines whether turmeric can actually influence inflammation and collagen protection in the body. Multiple pharmacokinetic studies, including research published in Molecules and Nutrients, have demonstrated that curcumin's bioavailability increases significantly when consumed alongside dietary fat. This is because curcumin is lipophilic, meaning it binds to fat molecules, allowing it to pass more effectively through the intestinal barrier and enter systemic circulation. Without this step, most curcumin is rapidly excreted, never reaching the tissues where it could support collagen preservation. For women over 60, this matters even more. Digestive efficiency often declines with age, and absorption of fat-soluble compounds becomes less predictable. Pairing turmeric with a healthy fat, such as olive oil, full-fat yogurt, or avocado, helps stabilize absorption and creates a gentler, more reliable delivery of curcumin into the bloodstream. This approach aligns with how the body processes nutrients later in life, rather than forcing it to behave as it did decades earlier. From a collagen perspective, this method does not aim to stimulate rapid production, which is unrealistic at this stage of life. Instead, it supports a protective strategy by reducing inflammatory signaling and limiting the enzymatic breakdown of existing collagen fibers. Over time, this shift can help the skin maintain thickness and resilience, making wrinkles appear less rigid and more responsive to natural repair processes. If this approach makes sense to you so far, take a moment to interact with me in the comments. Type 1 if you've been using turmeric but never realized absorption depended on healthy fats, or type 0 if this is completely new information for you. Your responses help me understand where women are starting from and how best to guide you. With this foundation in place, the next step is not about adding more or doing more, but about understanding how turmeric can be used at the right time of day to support the skin's natural repair rhythm, which becomes especially important after 60. This is why consistency and proper pairing matter far more than dosage, because even small amounts of turmeric can be effective when the body is actually able to use them efficiently over time. 4. Method 2. Golden milk for night skin repair. As we move from daytime protection into nighttime recovery, the way turmeric is used becomes just as important as the timing, because the body's priorities shift significantly after the evening hours. At night, the nervous system gradually transitions from alertness to repair. Circulation slows, and hormonal rhythms begin to favor maintenance rather than activity. For women over 60, this transition is often less smooth than it once was, which is why nighttime support must be gentle, calming, and biologically aligned rather than stimulating. Golden milk, when prepared correctly, fits this role, not as a traditional comfort drink, but as a low-dose delivery method that supports the skin's overnight repair environment. The warmth of milk has been shown to promote relaxation and improve sleep onset, while small amounts of curcumin introduced at this time help reduce inflammatory signaling without overactivating the digestive system. Research published in Nutrients and Frontiers in Pharmacology suggests that curcumin can modulate inflammatory pathways and oxidative stress markers more effectively when cortisol levels are lower, a state that naturally occurs during the early stages of sleep. What makes this approach particularly suitable after 60 is its restraint. Unlike higher daytime doses designed to protect collagen during active hours, golden milk works by maintaining a calm internal environment that allows repair processes to proceed without interruption. Fibroblasts, which are responsible for maintaining collagen structure, function more efficiently when nighttime stress signals are reduced, and blood glucose remains stable. Milk provides a small amount of protein and fat that supports this balance, while the warmth encourages peripheral circulation and relaxation. It is important to understand that this method does not aim to stimulate collagen production directly, nor does it promise visible changes overnight. Instead, it supports the conditions under which collagen repair is least likely to be disrupted. Over time, this consistency can help the skin recover more evenly from daily stress, leading to gradual improvements in texture resilience and how wrinkles respond to normal facial movement. Equally important is what this method avoids. Golden milk should be prepared with modest amounts of turmeric free from added sugars and consumed well before bedtime to prevent digestive discomfort. When used as a steady nighttime ritual, rather than an aggressive intervention, it complements daytime strategies by protecting the fragile repair window that becomes increasingly valuable after 60. With the skin supported from within during the night, the final consideration is how turmeric can be applied externally in a way that respects aging. Skin minimizes irritation and reinforces the protective work already taking place beneath the surface. 5. Method 3. Topical turmeric for local collagen protection. After addressing inflammation and collagen stability from within, it is natural to ask whether turmeric has a place on the skin itself, especially when wrinkles appear most visibly on the face. The answer is yes, but only when turmeric is used with a clear understanding of aging skin biology and with realistic expectations about what topical support can and cannot do after 60. Topical turmeric does not rebuild collagen in the deep dermis, and it should never be presented as a substitute for internal repair processes. Its value lies instead in local protection. As skin ages, the outer barrier becomes thinner, more reactive, and more prone to low-grade inflammation triggered by environmental exposure, facial movement, and even daily cleansing. This surface inflammation may seem mild, but over time it sends stress signals deeper into the skin that further weaken collagen fibers. Curcumin has been widely studied for its anti-inflammatory and antioxidant effects on the skin barrier. Research published in the Journal of Clinical and Aesthetic Dermatology has shown that curcumin can reduce inflammatory mediators in the epidermis and improve barrier resilience when used in low concentrations. By calming local inflammation, the skin becomes less reactive, which indirectly reduces the mechanical and biochemical stress placed on underlying collagen structures. For women over 60, the concept of short contact therapy is especially important. Aging skin is slower to recover from prolonged exposure, so turmeric should never be left on the skin for extended periods. Instead, brief application followed by gentle removal allows the skin to benefit from curcumin's calming properties without triggering irritation, dryness, or discoloration. This approach respects the reduced regenerative capacity of mature skin while still offering meaningful support. When topical turmeric is used in this controlled way, many women notice that their skin feels more stable, less sensitive, and better able to tolerate daily movement without forming rigid crease patterns. Wrinkles do not disappear, but they often appear less fixed as the skin regains a degree of flexibility and comfort. This effect is subtle, but cumulative, particularly when combined with internal strategies that protect collagen from ongoing breakdown. What matters most is integration rather than intensity. Topical turmeric works best as a reinforcing layer, supporting the calmer internal environment created by dietary and nighttime approaches. When inflammation is addressed both systemically and locally, the skin is placed in a position where repair signals are no longer constantly interrupted. At this stage, wrinkle care shifts away from chasing dramatic change and toward preserving structure, comfort, and resilience, which is the most realistic and sustainable goal for skin health after 60. 6. How to start gently and what to expect. When it comes to supporting collagen after 60, the most common mistake I see is not choosing the wrong ingredient, but expecting the body to respond faster than it realistically can at this stage of life. Aging skin does not need aggressive stimulation. It needs consistency, stability, and time to rebuild trust in its own repair systems. This is why starting gently is not a compromise, but a strategic advantage. In the first week, the changes you may notice are often subtle and sensory rather than visual. Many women report that their skin feels less tight, in the morning appears slightly calmer, and responds more comfortably to facial movement even if wrinkles themselves still look the same. This early phase reflects reduced inflammatory signaling and improved barrier comfort, which are essential prerequisites for any deeper repair to take place. By the second and third weeks, internal and external support begin to work together more cohesively. As collagen breakdown slows and nighttime repair becomes less interrupted, the skin often regains a modest degree of flexibility. Fine lines may appear softer at rest and deeper. Wrinkles may feel less rigid when the face moves. These shifts are gradual, but they signal that the skin's structural environment is becoming more balanced rather than constantly under stress. It is also common during this phase to notice changes in how the skin holds moisture and responds to daily habits such as cleansing massage or sun exposure. When inflammation is lower, the skin barrier becomes more resilient, allowing hydration to remain more stable and reducing the exaggerated dryness or sensitivity many women experience after 60. It is important to understand that progress is not linear. Some days the skin may look unchanged, while other days it may appear brighter or more even without an obvious reason. This variability is normal and reflects how repair processes fluctuate with sleep quality, stress levels, circulation, and hormonal rhythms. The goal is not perfection, but stabilization, because once collagen loss is slowed, the skin has a better chance to maintain what it still has. Perhaps most importantly, this approach reframes success. Instead of chasing dramatic transformation, it focuses on preserving thickness, comfort, and resilience, which are the true foundations of healthy skin after 60. When expectations align with biology, frustration decreases, adherence improves, and meaningful change becomes far more sustainable. With that understanding in place, the final step is to bring these elements together into a long-term perspective on skin health that supports confidence rather than constant correction. 7. Safety notes you should not ignore. Before incorporating turmeric into a long-term routine for skin and collagen support, after 60 it is essential to address safety with the same seriousness as effectiveness. At this stage of life, the body's detoxification systems, hormone balance, and medication sensitivity are no longer as forgiving as they once were, which means even natural compounds must be used with informed restraint. One of the most important considerations involves the gallbladder and bile system. Curcumin can stimulate bile flow, which may be beneficial for some, but potentially problematic for women with a history of gallstones, gallbladder disease, or bile duct obstruction. In these cases, turmeric may aggravate discomfort or trigger symptoms, which is why medical guidance should always come first. Medication interactions also deserve careful attention. Turmeric has mild anticoagulant properties, and when combined with blood-thinning medications, it may increase the risk of bruising or bleeding, particularly with higher doses or prolonged use. This risk becomes more relevant after 60, when vascular integrity and clotting balance naturally change with age. Liver health is another area where moderation matters. While curcumin has been studied for its antioxidant and protective properties, concentrated supplements or excessive daily intake may place unnecessary metabolic stress on the liver, especially in women with pre-existing liver conditions or compromised detox capacity. Choosing food-based or low-dose approaches often places less strain on hepatic pathways while still providing meaningful support. Topical use requires equal caution. Mature skin is thinner, slower to heal, and more reactive to prolonged exposure. Leaving turmeric-based preparations on the skin for extended periods or using them too frequently can lead to irritation, dryness, or inflammation that counteracts any potential benefit. Patch testing and short contact application help reduce this risk. It is also important to recognize that individual responses vary. Some women may tolerate turmeric well, while others may experience digestive discomfort or skin sensitivity even at low doses. Listening to early signals from the body is a critical part of safe use, especially when introducing any new compound later in life. Finally, turmeric should never be framed as a replacement for medical care prescription treatments or professional evaluation. Its role is supportive, not corrective. When used thoughtfully with respect for individual health conditions and biological limits, turmeric can complement a broader strategy for skin health after 60. But it works best when guided by realism, patience, and informed decision-making. Wrinkles after 60 are not a sign that your skin has failed you, but a signal that collagen protection and repair now require a different approach, one that works with your body rather than against it. By understanding why collagen breaks down, how turmeric helps reduce silent inflammation, and how gentle, consistent habits support long-term skin resilience, you give your skin the chance to stabilize, soften, and age with strength instead of frustration. My advice is simple. Start slowly, stay consistent, and remember that real repair is measured in balance, not overnight change. If you found this video helpful and would like to support the channel, a small donation can help us continue creating clear, science-based content for women after 60, and I truly appreciate it. Please remember to like this video, share it with someone who may need it, subscribe to the channel, and thank you for spending this time with me today.